Yeah, and I was gonna say, because you had said you keep saying return to sport, and I guess for those who are not in the rehab realm, the merit and the weight behind that statement is super important because it doesn't just encompass like one plan; it encompasses many different like aspects of it. It's the, you know, the mindset of the player, it's the training load, like what they're doing, and everything kind of goes into this whole plan of return to sport. And I think maybe for others who aren't used to that idea of like return to sport, how would you describe return to sport?
Yeah, kind of what you said. I mean, it's all encompassing. It's the physical metrics from a strength and power perspective. It's the proprioceptive feedback. It's the court specific or sport specific demand and load. It's their conditioning, their level of their level of conditioning. I guess it's everything. It's not it's not just looking at their knee joint. It's, you start there and you potentially isolate that specific joint or that, whatever injury is being repaired, and then you start to integrate it with the rest of the body. And then you just understand how the integration of that specific injury is going to be stressed once they do have to get back, and then building back from there. So kind of reverse engineering of, okay, this is a shooting guard with anterior knee pain who has trouble doing a step back, and et cetera, et cetera. Okay, well, how do you reverse engineer that to make sure that when they do return, they return at a high level, performance and physically? So again, just being able to work backwards and start trying to introduce that as soon as possible. It's a continuum, and there's, you start day one really, but there's just going to be different kind of perspectives throughout.
No, I think that's super helpful. I think the idea of working backwards is something that I've tried to implement as well with my patients of like, okay, what is the picture perfect idea of what this person needs to do moving forward? And once you have that idea, you kind of have a target to shoot towards. And I think that's super important because if you don't know if you don't know what to aim at, how are you going to get the patient better? If every person who walks in with knee pain, I mean, this is an ortho example, but if every person comes in with low back pain or knee pain, you're given the same set of examples or same set of exercises, you're not really tailoring that exercise program or that exercise selection towards the patient.
Exactly. Yeah. So there's like, and even in basketball, I mean, you have, obviously everyone is on the court together, but per position, per like, a step back might be a lot to some guy, and that takes one type of load to the whatever joint we're referring to, versus a center who really needs to get that contact and the stability with the contact. So being able to really understand like that end, that what that end looks like, and then yeah, like you said, working backwards and making sure to individualize it. So I think that's huge in the return to play process.